So good evening, friends. And this is, we can always start a debate as to whether Sharda ma'am speaks better or she sings better. So as of now, I think we'll stick to that she speaks the best. Singing will come later. So I invite the chairperson for our fest, Dr. Uma Rai. She needs an introduction. She's a beloved and dear teacher. And Dr. Raj Bukaria, in case she's gotten free from her OPD. Dr. Raj, are you there, ma'am? So I think she'll be joining us shortly. Dr. Raj, please to welcome Dr. Raj is there.
Hi, Dipti. Hi.
Hello. Good evening, ma'am. Yes, you are there. Good evening, ma'am. Good evening. So Dr. Ruma and Dr. Raj to please chair the session. And Dr. Ruma, will you please invite the speaker for today's session on influenza vaccine?
Good evening, friends. And to introduce Sharda, I really don't know how to introduce her. You know, we go back, our friendship goes back to more than 40 years. And she is honestly a very, very good speaker. And today she is going to talk about adult vaccination. And I think it's a very important topic, and especially in a situation when COVID-19 is there and we are all so upset. So let's hear Dr. Sharda Jain without wasting your time.
Hello.
Yes, ma'am.
I think good evening, everybody who is listening me. Today's CME is dedicated to vaccination in adults. I'm personally very fond of vaccination, and 3 vaccinations I love to speak whenever I get opportunity. The first is HPV vaccination. All of you know about it, that in 2020, the WHO has, in the cancer report has said that the HPV vaccine has the highest impact as far as the vaccination is concerned. If you give 1,000 vaccinations, you save 20 lives. No other vaccinations come near it. The second is, I usually talk about is flu vaccination. And the third one is Tdap, and justice will be done for Tdap vaccination by Dr. Jyoti Bhasker. Why I love to speak on flu vaccination. This particular vaccination, I'm emotionally involved with it. Way back in 1989, my husband had a mild flu. He did not even tell anybody. He went to the physician and said, I have got Guillain-Barré syndrome. And he had it. I was lucky that he was discharged from the hospital in 17 days' time, and he recovered completely as far as his 4 limbs were concerned. And that changed my life, that from a teacher in the medical college, I came down to become a practitioner. I have no regrets. But since the time this adult vaccination came, me, my husband, and my family, and I motivate each and every member of my clinic to take flu vaccination. When I talk in detail, you will hear about it. I do talk about TD instead of TT, and it has taken almost 15 years to motivate the government that छोटे-छोटे countries ने TD ले लिया और अभी हम अपने सरकारी उसमें TT पे चले जा रहे हैं. So now you're lucky to know that in 2019, there is no more stock of TT coming in the government. It is only TD. The government cannot include Tdap in their vaccination program because it is expensive. Dr. Jyoti is going to deal in detail about it. about the Tdap. So coming to flu vaccination. Sarji,
Yes, ma'am.
so today my focus is to talk on flu vaccination. I'm going to talk about a little bit about influenza, the outbreaks, the impact of influenza, what is the rationale for vaccine, its safety and effectiveness, when, whom, and how to vaccinate. As far as the flu is concerned, the epidemics have been described by Hippocrates in 5th century BC. Rest, all of you know much better than myself. Today, if you ask any child also to speak about influenza, he will present much better than what I am going to present. But coming to very specifics which I want to highlight. Influenza has a virus which has several subtypes A, B, and C. A and B causes seasonal epidemics, while C mainly causes mild respiratory illness. Influenza A is divided into subtypes based on HA and NA proteins. Influenza infection has a variety of symptoms, and this August gathering knows it in detail. The symptoms that are associated with seasonal influenza are well defined and can vary between individuals. The virus shedding in adults is known up to 5 days after the illness onset. In young children, it is little more than 10 days, while in severely immunocompromised patients, it takes weeks to months. Remember, in 30 to 50% of patients, this particular disease remains asymptomatic. As for the clinical differentiation from common cold and flu is concerned, in flu, there is a high fever, headache, myalgia, fatigue and weakness and extreme exhaustion is noticed. Severe chest discomfort and cough is more in flu than in common cold. I think people are saturated, how it spreads. Respiratory droplet transmission, droplet only travels to up to 1 meter, and that's why we are talking about 2 gaj ki duri. And by contact with surfaces contaminated with the respiratory droplets, by airborne transmission of evaporated droplets that may remain in the air for a long period of time. The virus transmission can be slowed by social distancing according to the CDC. The reservoirs of influenza virus are the migrating aquatic birds. But this phenomena of influenza virus is known, which is known as drift and shift. Drift presents as seasonal flu, shift is when it takes the pandemic flu. And anything can be the source, right from the human beings to the other things. We all know that when a child goes to the school, the child gets fever every 6 weeks. Those flu episodes are less severity, but they are higher in frequency. The flu manifestation, which has a greater severity, has a lower frequency, which presents as pandemic, and the rest are seasonal flu. This particular chart shows the history in the last 100 years. We all know about 1918 influenza pandemic. 50 million people were lost, their lives were lost during this time. After that, in 1957, it took 2 million. In 1968, it was 1 million. And in 2009, the deaths were only numbered. Recent lab confirmed Indian flu data also, and we are lucky that now we have some of our own data. The time interval here has been taken is from 2014 to 2017. You can see here, as is happening in corona infection these days, that majority of the cases are concentrated in Maharashtra. This was there in earlier epidemics too. The next in line is Delhi, which takes 17%, and then it is Tamil Nadu, and the rest of country is the rest. This shows the distribution of flu cases according to the age. I wish to highlight that the maximum cases are seen between 30 to 50 years. And this adult takes care of his wife, takes care of the elderly, takes care of the newborns and the children, takes care of the people who are immunocompromised, but he or she does not care of themselves. And this highlights that it is high time adult vaccination people wake up. Now, coming directly to the vaccine, as far as the history is concerned, the first generation of vaccine used the whole virus, which came in 1945. The second generation came, which uses the split virus vaccine, came in 1964. And the third generation is, which has subunit vaccine. It is called subunit vaccine. And this particular third generation has got better tolerability. It is, effectiveness is much better compared to the earlier vaccines. Now people are talking about, till now there was a trivalent vaccine. Since 2019 is a quadrivalent vaccine has come. Why there is a need that we switch over to quadrivalent vaccine instead of trivalent vaccines? The rationale is the trivalent was taken over when the bivalent disappeared, and similarly quadrivalent should take over because it has more advantages than the trivalent vaccination. But as far as the medical fraternity is concerned, we all know that in antenatal screening for detecting aneuploidy, there is a triple test and there's a dual test. Both need to be combined with ultrasounds. The triple test is history because effectiveness of detecting the disease is only 50%. But still I was told by the last clinic that the 50% requests are still for a triple test and not for the dual test. And that's why my humble request to each and everybody who's listening me, when a newer technology comes, you have to grab it. I just wish to highlight again that influenza has subtypes A, B, and C. I did tell you that A and B are caused for seasonal epidemics. The C is mainly causing mild respiratory illness. The A is subdivided into HA and NA. Till in triple vaccine, where we will not using this beta subunit, which is making its impact now. So why the triple vaccine has to go and the quadrivalent vaccine has to be taken? Shasha has summarized why quadrivalent vaccine is important, because the protection offered by the trivalent vaccine is unsatisfactory. And the inclusion of the fourth antigen in the vaccine is feasible and safe. It does not only reduce the immunogenicity to other antigens which is there in trivalent vaccine, or overall manufacturing capacity of the influenza vaccine. So the rationale of quadrivalent vaccine is that almost 11% of all influenza B infections which still occur with, even if I take trivalent vaccine, you'll find 11% people will still have influenza caused by B infections, and thus reducing the influenza burden on the community. Quadrivalent vaccines could reduce both direct costs in the term of medical visits, hospitalizations, and antibiotic prescriptions. And indirect costs related to working days lost by the affected people and their caregivers. Now, Northern Hemisphere vaccine is already out, which is going to be effective till almost June 2021. You can see here, it has got 2 A subtypes and 2 B subtypes. And these 2 viruses are new, and that's why people like us who had taken the dose in April have taken it again now, because these 2 viruses are new, and the season of winter is going to come. It can cause problem in elderly people like us. Now, what are the high-risk group? The high-risk groups are elderly, pregnant lady, children up to 5 years, individual with chronic medical conditions, and who are immunocompromised, and the people who are healthcare workers. I always ask one question. I have these 5 individuals, 1 pregnant lady, 1 elderly lady, 1 newborn, 1 healthcare worker, and 1 immunocompromised. Whom should I give vaccine? And the answer is the pregnant lady. So that's a priority, and that's a message which I wish to give it to you. Now, as far as the pregnant woman and influenza is concerned, pregnant women are at particular risk of severe complication and death from influenza. And the risk is exacerbated by the comorbidities like asthma, diabetes mellitus, and obesity. And if she is in a late trimester of pregnancy, then you find her problems of hospitalization and deaths increases. May also lead to complications such as stillbirth, neonatal deaths, preterm delivery, and decreased birth weight of the child. So I repeat again, the hospitalization, if she gets flu, mortality increases 4 times. And in case she happens to have conditions already present, the mortality is 10 times. And the chances of her getting the problem is 10 times. So the benefits are of maternal immunization against influenza. Not only it protects the woman, but also prevents negative effects on the fetal development due to maternal influenza infection, and reduces rate of illness in infants for at least first 6 months of life. So inactivated vaccine has been shown to be safe and effective in pregnant women and their offspring when given at any trimester. Now, as for the healthcare workers are concerned, we all know that the vaccination rate of the healthcare workers remains low in many countries. And because, as happened this time, 550 doctors' lives were lost. Little more than this number, the nurses' lives were lost. And many paramedics had been lost. We people don't care of ourselves. And we are the biggest source of spreading the infection in the community. So if we take the vaccination not only is going to protect healthcare workers, it is also going to protect the vulnerable patients in the contact which we come in contact with them. It also may reduce the work absenteeism and consequent disruption of health services. And that's why no wonder Dr. Harshvardhan has said that the first 25 lakhs vaccine which are going to come about corona infection are going to be given to the health workers, that they will have the first priority. So as for the burden of influenza and pregnancy is concerned, I'm repeating again, the disease burden for influenza among pregnant women is significant, particularly in low-resource environments and developing countries. Almost 5% of deaths in 2009 pandemic, pregnant women were responsible. We should not forget, in case of the influenza occurs during pregnancy, depending upon the trimester it occurs, it gives rise to spontaneous miscarriages, stillbirth and premature births, and four-time increase in the odds of cesarean delivery. The women who are delivered preterm were more likely to be infected by flu virus during the third trimester, to have a secondary pneumonia, and to have been admitted to ICU. So the risk of influenza as far as infants are concerned, we all know, in case if the mother is not immunized, the most vulnerable person is the newborn up to 6 months. And the factors involved are the immaturity of the infant's immune system, the absence of prior immunity, exposure to the virus, and increased vulnerability to cardiorespiratory conditions. And we all know, in case if the infection occurs in the first 6 months, 5 per 1,000 deaths, and if the infection occurs in the up to 2 years, it is 1 per 1,000. And the same data is available from the US. So what is the rationale for influenza vaccination? It reduces the number of influenza-related hospitalization and deaths. Vaccination of pregnant women reduces the burden of influenza in the children less than 6 months in 2 ways. It reduces the risk of being infected after delivery, thus also reducing the risk of transmission to the child during the first few months of life, that is 6 months, and the transmission of influenza antibodies from mother to the child. Because both the use of antiviral therapy as well as influenza vaccination is not needed in newborns less than 6 months of age, because the antibodies are being transferred from the mother to the child. So by giving a vaccination to the mother, the outcome is, which is impacted almost 50%. It reduces the healthcare seeking, hospitalization. It reduces acute respiratory illnesses in the newborns, influenza-like illnesses, febrile episodes, and administration of antibiotics. As for the safety of the influenza vaccine is concerned, it has got excellent and robust safety profile. As for the conclusions about this vaccine are concerned, the results do not indicate that maternal influenza vaccination is associated with an increased risk of fetal death, spontaneous abortion, or congenital malformations. The systemic review as far as the congenital malformations is concerned did not indicate an increased risk of congenital anomalies after maternal influenza immunization, consolidating the safety of the influenza vaccine in pregnancy. How to vaccinate? Foxy recommends it from 26 onwards. As for the American College is concerned, it can be given anytime, and that's the recommendations otherwise. WHO says it recommends seasonal influenza vaccination to pregnant women is the highest priority. What is the best vaccination strategy to protect infants less than 6 months? Maternal immunity is the only effective strategy in the newborns because the vaccine is not approved for use in infants younger than 6 months. Protecting the mother and her unborn child from serious illnesses by vaccinating the pregnant woman. As far as this flu is concerned, this is very closely monitored by WHO world over. Everywhere there is a WHO guided labs are available which screen which viruses to be included in the vaccine. As for the seasonality of flu is concerned, India has a distinct seasonality. Rainfall correlates with influenza peaks, and the peak of this influenza occurs during the monsoon, that is rainy season. This rainy season in the country lasts from June to August in all the regions except Tamil Nadu, where it is October to December. So I advise that, before the monsoon starts, the vaccination needs to be taken. Otherwise, limited influenza activity is usually seen throughout the year in India, with a clear peaking during the rainy season. So thank you very much for patiently hearing with us. And in case if there are any questions, I'll be too happy to answer.
That was a wonderful talk, ma'am, as always. Dr. Uma Rai, your comments, please.
questions by anybody?
There's a question from Dr. Rekha Shrivastava.
Yes.
She's asking if I want to ask if a lady got vaccination just before conception, should she get vaccination out of during pregnancy?
सर आपकी बात सुनाई नहीं दी मुझे.
Rekha Shrivastava.
Ma'am, the question is that if a lady gets vaccinated
She get vaccine or flu in
just
pregnancy?
before she plans a baby, I'll ask the question, Mr.
No, ma'am.
Sir. So, ma'am, the question is that if the lady, she gets vaccinated and she's already got the vaccination before she conceived, now she's conceived, should the vaccination be repeated? Ma'am, we can't hear you.
In case if she has taken the vaccination within 1 year, then she does not repeat it. Hello?
Yes,
Can you
ma'am.
hear me?
Yes, ma'am. Definitely. Dr. Raj, Dr. Rumarai, we need your expert comments.
My
Dr.
question
Raj.
is only to everybody. Have you taken the vaccination or not? I'm just trying to tell you, we have been taking for a very long time, and you'll find this common cold, flu, and things like that will go away once you start taking the vaccination. And there's no point risking yourself. It is to be taken yearly, but there is no point risking yourself by uncomplicated things. It becomes complicated once you have the flu vaccination.
Just have one question.
A special request to all gynecologists. I can talk about East Delhi. There are only 20 gynecologists out of 350 gynecologists who are giving vaccination. You must offer them vaccination. In case if she refuses, write on the file that she refuses vaccination. No doubt it is costly. The cost is not much. It is just 1,500 now with the quadrivalent vaccination. I think they must offer it, and they should use this is a good practice. First, they should take it themselves, give it to their spouse, give it to the elderly people in the house, give it to the clinic staff after the vaccination is concerned, and they must practice vaccination in pregnant ladies. I told you the example. If I have one vaccination and I have to, there are 5 people who are seekers, and for all 5 by this category, the vaccination goes to the pregnant ladies. So that is the priority, and that's a take-home message for all.
Ma'am, there's a
I
question.
think, what we should do is, sir, is that, we should go for second presentations, and then we can take question and answer after.
So I invite the second speaker, Dr. Raj, please invite the